All right, let's dive in. Today, we're tackling a topic that you might not think is all that exciting, but trust me, it's way more interesting than you'd expect. We're going deep into the world of dental hygiene.
Sounds intriguing.
It is. I've got some real-life case studies from a dental board exam review book, which means we're basically going behind the scenes to see how dental hygienists figure out what's going on with a patient's mouth. It's kind of like detective work, but for your teeth.
I see where we're going with this. I'm in.
Awesome. So let's jump right into our first case, Case A. This is a pregnant patient who's dealing with some mild inflammation and bleeding between her teeth. Now, the case study mentions gingivitis, but not periodontitis.
Okay.
So for those of us who haven't been to dental school, can you break that down for us? What's the difference?
Sure. Gingivitis is basically inflammation of the gums, usually caused by plaque buildup. Think of it as the first stage of gum disease. The good news is it's usually reversible with good oral hygiene. Periodontitis, though, that's a different story.
Oh.
Yeah, periodontitis is the more advanced stage where the infection has spread deeper, damaging the bone and the tissues that support your teeth. Now, this case specifically says there's no radiographic bone loss, meaning no bone damage shows up on the x-ray.
So that's why it's just gingivitis for now.
Exactly.
Okay, so gingivitis is like the yellow light, a warning sign, and then periodontitis is the red light, right?
You got it.
But even though our pregnant patient only has gingivitis, they say she's still at moderate risk for cavities. Why is that?
Well, there are a few things contributing to that risk. First off, she hasn't been to the dentist in a while. Life gets busy, it happens. But, any break in regular cleanings can definitely make cavities more likely.
Makes sense. Consistent care is key, just like with anything else.
Absolutely. And another factor is something called decalcification. These are those white spots that you sometimes see on teeth. They're basically early signs of decay where the enamel, that hard outer layer of the tooth, starts to break down. And to make matters a little more complicated, she's also dealing with dry mouth. It's probably a side effect of her antidepressant Zoloft.
Okay, so we've got inconsistent care, weakened enamel, and dry mouth. That does sound like a recipe for cavities, but I'm curious, why is dry mouth such a big deal?
Saliva is actually your mouth's natural defense system. I mean, it helps neutralize acids, it washes away food, it can even help remineralize that enamel we were talking about. When you don't have enough saliva, your teeth become much more vulnerable to decay.
It's like having a weakened immune system, but for your teeth.
Exactly. It's a great way to think about it, and honestly, it's something a lot of people just don't realize.
Now, I have to ask about something that really caught my eye in this case, dilaceration. Sounds kind of intense. What exactly is that?
It's not as bad as it sounds. Dilaceration just means there's a bend in the root of a tooth. It happens during development, and it doesn't always cause problems. But it is something the dentist needs to know about, especially if any work needs to be done on those teeth.
Yeah, I bet that would complicate things a bit.
For sure. And of course, being pregnant adds another layer of complexity, too.
Right. You can't forget about that. What are some of the things you have to think about differently when you're treating a pregnant patient?
Well, for one, pregnancy hormones can actually make gums more sensitive and more likely to get inflamed. So keeping those gums clean is super important during pregnancy. And then we also have to be really careful about certain medications and treatments like x-rays. We try to avoid them during pregnancy if we can, especially in those first few months.
So it's all about weighing the risks and benefits.
Exactly.
Sounds like there's a lot to juggle.
Oh, there definitely is. But with careful planning, good communication between the patient and the dental team, we can make sure that both mom and baby stay healthy.
That's good to hear. All right, let's move on to our next patient, Case B. This person has rheumatoid arthritis, which is an autoimmune disease that affects the joints. Now, what I'm curious about is, what does that have to do with their teeth?
This is a perfect example of how your oral health is connected to your overall health. Rheumatoid arthritis, because it's a systemic inflammatory disease, can actually increase the risk of periodontal disease.
So the same inflammation that's happening in the joints can also happen in the gums.
Exactly. And to make matters worse, a lot of the medications used to manage rheumatoid arthritis can cause dry mouth, which, as we talked about, can lead to a ton of dental problems.
Well, that's a double whammy. Poor guy. What else is going on with this patient?
Well, he's having some sensitivity in one of his teeth. Probably because of gingival recession. That's when your gums pull away from the tooth and it exposes the root surface.
Oof, I've had that before. Not fun.
Not fun at all. And based on the x-rays in the exam, this patient is showing signs of stage 2 periodontitis. That means there's already some bone loss and damage to the stuff that holds those teeth in place.
So it's gone beyond that initial gingivitis stage. What does treatment look like at this point?
Well, it'll likely involve a deep cleaning. We call it scaling and root planing. It removes plaque and tartar from under the gum line and smooths out the roots to help the gums reattach. We'd also want to address that dry mouth and make sure they know how to keep things clean at home.
Speaking of keeping things clean at home, I noticed this patient has a dental implant. Is there anything special they need to do to take care of that?
You bet. Implants need the same meticulous care as natural teeth, maybe even more so. The good news is there's no sign of periimplantitis, which is inflammation around the implant. That means it's healthy, but, staying healthy is key.
Gotcha. Okay, let's shift gears now and talk about case C. This is our youngest patient so far. And this case really drives home the importance of good oral hygiene habits early on. Tell us about this little guy.
So he's got a lot of decay between his teeth, and he admits it's mostly because he hasn't been flossing regularly.
Oh, no.
It's a classic kid problem. They haven't quite figured out how to floss well, and they don't always understand why it matters.
Yeah, I can relate to that. I don't think I took flossing seriously until I was much older.
Right. But there's this interesting ethical dilemma that comes up in this case. His mom wants to just pull one of his decayed baby teeth, but the hygienist wants to try and save it. Why do you think that is?
Well, I know baby teeth eventually fall out, but I'm guessing they actually have a bigger role than I thought.
You got it. Baby teeth are super important for jaw development and making sure the permanent teeth come in correctly. Taking out a baby tooth too early can cause crowding, bite problems, and even speech issues.
Wow, I had no idea. So it's about way more than just how it looks. It's about the long-term health of their mouth.
Exactly. Plus, the permanent tooth that would replace this particular baby tooth won't be ready for years. Restoring the baby tooth lets it act as a placeholder and ensures there's enough space for the adult tooth.
Makes perfect sense. Now, for a kid this young, what's the best way to get all that plaque out of there? I mean, regular flossing seems like it would be a challenge.
Yeah, probably. In this case, a rubber cup polish would be the way to go. It's gentle on those little gums and does a fantastic job of getting rid of plaque and surface stains.
So, less scary for the kid. That's good. This case also mentions that he had a really high fever earlier in the year. Could that have affected his teeth at all?
It actually could have. High fevers, especially when kids are really little, can mess with enamel formation, making those teeth weaker and more prone to decay.
Huh. I never knew that.
Oh.
It's amazing how everything in our bodies is connected. This case throws in another curveball, too. A language barrier. The mom doesn't speak English. How does the dental team work with that?
Communication is so important in dentistry, right? In this case, you'd absolutely need a translator to make sure the mom understands the diagnosis, the treatment options, and any risks or benefits. It's about respect, making sure everyone can make informed decisions about their health.
Totally agree. It's about building trust and making sure everyone is on the same page. Okay, are you ready to tackle our final case for today?
Bring it on.
All right. Case D is a patient with let's just say they've got some serious dental issues. So tell us, what are we looking at here?
This patient is showing us what advanced periodontal disease looks like. We're seeing class 3 furcations on all their molars.
Okay, can you break that down for me a bit? What's a class 3 furcation and why is that a bad thing?
Of course. Imagine the roots of your tooth are like the branches of a tree. Furcation involvement means there's bone loss between those roots, and that creates a space, a little pocket, where bacteria can hang out and do their thing. And class 3, well, that's the most severe type. It means the bone loss is so bad that the space between the roots is completely open.
So basically, it's like an open door for bacteria to just move right in.
Pretty much. And that can lead to a whole bunch of problems. Pain, infection, and even losing the tooth altogether.
Yikes. And this patient is already having some discomfort, right?
Yeah, the case mentions sensitivity to sweets, hot and cold. That's usually a sign of exposed dentin, the layer under the enamel. And to add to the problem, there's a lot of calculus buildup. That's hardened plaque, and it can make the gums angry and lead to even more bone loss.
I'm sensing a theme here, and it's not a good one. What can you do at this stage to help someone like this?
At this point, we'd need to hit this from multiple angles. First, a deep cleaning to get rid of all that calculus and bacteria. Then we'd have to address the decay, which could mean fillings, crowns, maybe even root canals, depending on how bad it is.
This all sounds pretty overwhelming, honestly, both physically and emotionally. How do you deal with a patient's anxiety in a situation like this?
That's such an important part of dentistry, especially when things are complicated like this. Communication is key, making sure the patient understands what's happening, what to expect, and what their options are. Some people prefer morning appointments, so it's done and over with. Others might need something like nitrous oxide to help them relax during the procedures. It really depends on the person and what they need.
It sounds like being a good dentist takes more than just knowing the technical stuff. You need empathy and people skills, too. Are there any other specialists this patient might need to see?
Oh, yeah, probably. I definitely recommend a periodontist. That's a specialist who focuses on gum disease. They can offer more advanced treatment options. I'd also suggest a visit to a physician. The case mentions high blood pressure that's not well controlled, and there might be some heart concerns too. Remember how we were talking about oral health and overall health being connected? This is a perfect example of that.
It's all connected, isn't it? One problem can set off a chain reaction.
Exactly, and depending on the specifics of the decay and if there are any abscesses, they might need to see an endodontist for a root canal. And if any teeth are lost because of periodontal disease, a prosthodontist can help replace them with dentures, bridges, or implants.
Wow, that's a whole team of dental professionals.
Yeah.
This case really shows how important it is to think about dental care holistically. It's not just about fixing teeth, it's about looking at the whole person and addressing all the interconnected factors.
I couldn't agree more. And speaking of looking at the whole picture, there's one more detail in this case that I found a bit concerning. During treatment, the patient complains of some chest and shoulder pain.
Uh-oh. That doesn't sound good. What could be going on there?
That's something we have to take very seriously. Given their history of uncontrolled high blood pressure, we have to think about the possibility of something happening with their heart, maybe angina, or even a heart attack. Thankfully, dental professionals are trained to spot and respond to medical emergencies. So in this case, we'd immediately stop treatment, check their vital signs, give them oxygen if needed, and call 911.
Wow, that's intense. It's a good reminder that dentists aren't just focused on teeth. They're looking out for the whole person. That's a lot of responsibility. Well, as we wrap up our look at these cases, what are some of the main takeaways you hope our listeners will remember?
For me, the biggest thing is how closely connected our oral health is to our overall health. We saw how conditions like rheumatoid arthritis and even pregnancy can affect what's going on in our mouths. And on the flip side, we saw how ignoring problems in our mouth can have serious consequences for the rest of our body.
It's not just about having a nice smile. It's about staying healthy.
Absolutely. And these cases also showed how important a thorough assessment is. We have to consider your medical history, the medications you're on, your lifestyle, everything. It all helps us make good decisions about your care.
Like I said, it's detective work before your mouth. What were some of the details from these cases that really stuck out to you?
One thing I noticed was how common dry mouth was. It popped up in the pregnant patient, the rheumatoid arthritis patient, and even the one with severe periodontal disease. People don't always realize how much it can impact their oral health.
It's like having a weak immune system, but for your mouth.
Hmm.
So what can people do if they're struggling with dry mouth?
The first thing is figuring out why it's happening. Is it a side effect of a medication? Is it a medical condition? Once we know that, we can come up with a plan to address it. There are over-the-counter things like saliva substitutes and sugar-free gum that can help stimulate saliva production too.
Oh, that's good to know. I also remember the mention of bruxism, which is teeth grinding in the first case, right? The wear on her teeth was a clue.
Exactly. Bruxism often happens without people realizing it. Stress, anxiety, some medications, even misaligned teeth can all play a role.
What kind of problems can happen if you grind your teeth for a long time?
Over time, you can wear down your enamel, making your teeth sensitive and more likely to crack or even break. And it can put a lot of strain on your jaw muscles, which can cause headaches, jaw pain, and even earaches.
Ouch. What can you do about that?
Well, finding ways to manage stress can help, and a custom-fitted night guard can protect your teeth while you sleep. Sometimes we need to consider orthodontic treatment to fix any bite issues that might be contributing to the grinding.
You also mentioned x-rays being important for diagnosis. What kind of information can you get from an x-ray that you can't see just by looking in someone's mouth?
X-rays let us see what's going on beneath the surface, inside your teeth and jaw. We can see bone loss from periodontal disease, cavities between teeth, the health of the roots, even infections like abscesses.
And in case B, the x-rays were really important for figuring out just how advanced the periodontal disease was, right? It turned out to be worse than it looked on the surface.
Absolutely. That's why regular checkups, including x-rays as often as your dentist recommends, are so important. We can catch things early when they're usually easier to treat.
And these cases showed us just how many different procedures there are in dentistry. We saw everything from simple cleanings to more complex stuff like root planing and extractions. What are some of the cool new technologies that are changing the game in dentistry?
Oh man, dental technology is changing so fast. One area that's really seen amazing progress is digital imaging. We now have 3D x-rays that give us incredibly detailed pictures of your teeth and jaw. It allows for much more precise diagnosis and treatment planning.
3D x-rays? That sounds pretty futuristic.
Right, it's pretty amazing. You've probably heard about laser dentistry too.
I have. What's the advantage of using lasers?
Lasers are more precise, they cause less bleeding, and they help people heal faster. They're being used for a lot of different procedures now, from treating gum disease to removing decay and even whitening teeth.
So going to the dentist is becoming less and less of a scary thing, which I think everyone can appreciate. But even with all these advancements, I imagine the human element is still super important.
Absolutely. Technology is a great tool, but it can't replace a skilled and caring dental professional. Building trust with patients, listening to their concerns, and providing individualized care are still the foundation of successful treatment.
Casey really brought up some important ethical considerations. I thought it was really interesting that the hygienist wanted to save the decayed baby tooth, even though the mom wanted to pull it. That really shows how committed they are to the child's long-term well-being.
You're right. That situation shows why it's so important to educate patients and make sure they understand their options. It's about explaining things clearly and helping them make the best choice for their health.
It's a delicate balance, for sure. And then, of course, we had the language barrier in that case. It just shows that we need to be sensitive to cultural differences and make sure every patient feels understood and respected.
Absolutely. Communication is everything in good dental care. We need to be mindful of language barriers, cultural differences, and anything else that might affect how a patient understands their oral health.
Expert speaker, this has been such an eye-opening deep dive. It's incredible how much there is to learn about dental hygiene.
It really is fascinating.
Before we wrap up, I want to touch on prevention. What are the key things our listeners can do to keep their mouths healthy?
You know, it really comes down to the basics. Brushing twice a day with fluoride toothpaste, flossing every day, and eating healthy foods.
Simple but effective.
Exactly. But let's be honest, life gets in the way, and sometimes those healthy habits slip.
I've been there.
That's why regular checkups are so important. It's not just about getting your teeth cleaned, it's about catching problems early, getting advice from your dentist, and getting personalized tips to help you stay on track.
And as we learned today, those checkups aren't just about your teeth. They're an important part of staying healthy overall.
That's right.
Expert speaker, any final thoughts before we sign off?
I'd say take a minute and think about your own oral health habits. What could you be doing better? Do you have any questions for your dentist at your next checkup? Remember, the more you know about your oral health, the better you can take care of that smile.
Great advice. Thanks for joining us on this deep dive into the world of dental hygiene. It's been a real pleasure having you here today.
It's been my pleasure. Always happy to chat about teeth.
And for our listeners, keep those pearly whites shining, and we'll see you on our next deep dive.
It really is fascinating how much goes on in our mouths that we never even think about.
Right. I know I've learned a ton already today. So let's keep digging into these cases. What else struck you as interesting?
Well, we talked about how important x-rays are for getting a full picture of what's happening. And in case B, those x-rays were really key in figuring out how advanced that patient's periodontal disease actually was. Turned out to be a lot worse than you might have guessed just by looking in their mouth.
That makes sense. Things aren't always what they seem. So those regular checkups, including x-rays, are crucial for catching things early on.
Exactly. Early detection is key when it comes to most health issues, and dental problems are no exception.
Speaking of those dental problems, these cases really highlighted the wide range of procedures that dental hygienists and dentists handle. I mean, we saw everything from basic cleanings to things like root planing and extractions. It's amazing how much you guys do.
It definitely keeps us busy.
I bet. But it also seems like technology is changing the game in dentistry. What are some of the advancements that are really making a difference?
Oh, technology is evolving at an incredible pace. One area that's really seen amazing progress is in digital imaging. We now have 3D x-rays, which provide incredibly detailed images of the teeth and jaw.
3D x-rays. That sounds pretty futuristic.
It is. It allows for much more precise diagnosis and treatment planning. And you've probably heard of laser dentistry becoming more popular too.
I have. Is all it's cracked up to be.
Lasers offer some real advantages over traditional methods. They're more precise, cause less bleeding, and promote faster healing.
That's great to hear. It sounds like going to the dentist is becoming less and less of a dreaded experience.
I think that's a win for everyone.
Definitely. But even with all this amazing technology, I imagine the human element is still crucial in dentistry.
You're absolutely right. Technology can enhance our capabilities, but it can never replace the importance of a skilled and compassionate dental professional. Building trust with patients, addressing their concerns, and providing individualized care, those are still at the heart of successful treatment.
Couldn't agree more. KC, with that little boy, really highlighted the ethical considerations that come into play in dentistry. I thought it was really interesting how the hygienist wanted to try and save that decayed baby tooth, even though the mom was ready to just pull it.
It's a great example of why patient education and informed consent are so important. The hygienist had a responsibility to explain the reasoning behind their recommendation and make sure the mom understood the potential consequences of both options.
It's a tricky situation for sure. And then, of course, you had the language barrier in that case, too. The need for a translator really underscores the importance of culturally sensitive care.
Communication is everything in good dental care, and that includes being sensitive to cultural differences, language barriers, and any other factors that might influence a patient's understanding of their oral health.
Well said. Expert speaker, this deep dive has been so eye-opening. Who knew dental hygiene case studies could be so interesting and thought-provoking?
You never know where you'll find fascinating insights.
That's for sure. But before we wrap up, I want to make sure we touch on prevention. What are some key takeaways for our listeners when it comes to keeping their mouths healthy?
Honestly, it really boils down to the basics. Brushing twice a day with fluoride toothpaste, flossing every day, and eating a balanced diet.
It's all about those healthy habits.
Exactly. But, we're all human. Life gets hectic, and those habits can slip sometimes.
I've definitely been there.
That's why those regular checkups are so important. It's not just about cleaning, it's about early detection, getting personalized advice, and staying on top of things.
And it's about so much more than just your teeth, as we've learned today. It's a vital part of overall health and well-being.
I couldn't agree more.
Expert speaker, any parting words of wisdom for our listeners before we sign off?
I would encourage our listeners to reflect on their own oral health habits. Are you doing everything you can to keep that smile healthy and bright? Do you have any questions for your dentist at your next checkup? The more informed you are, the better you can advocate for your own oral health.
Love that. Knowledge is power. Well, expert speaker, thank you so much for joining us on this fascinating deep dive into the world of dental hygiene. It's been an absolute pleasure.
The pleasure was all mine. Always happy to geek out about teeth.
And for our listeners, keep those pearly whites sparkling, and we'll catch you on our next deep dive.
It really has been fun, and I think it's so important for people to understand just how much their oral health impacts their overall health.
I agree. And I have to say, I'm walking away from this with a whole new appreciation for dental hygienists and dentists. You guys are like detectives, piecing together clues and figuring out what's going on beneath the surface. It's impressive.
Well, thank you. We do our best to stay on top of things. It's a constantly evolving field, which keeps things exciting.
I can imagine. Well, I think we've covered just about everything we can squeeze into this deep dive. Any final words of wisdom for our listeners out there in podcast land?
Let's see. I guess I would just encourage everyone to really take ownership of their oral health. Don't be afraid to ask questions, do your research, and find a dental team that you trust and feel comfortable with. Because at the end of the day, a healthy mouth is a happy mouth.
Well said. And on that note, a big thank you to you, expert speaker, for sharing your expertise with us today. This has been an enlightening deep dive into the world of dental hygiene.
It's been my pleasure. Always happy to talk teeth.
And for our listeners, be sure to brush, floss, and schedule those regular checkups. Until next time, stay curious and keep exploring.